we've just published a couple of weeks ago a scoping review looking at prevention in musculoskeletal pain in chiropractic, osteopathy, and physiotherapy. And I expected that there would be a lot of literature in that because, anecdotally, I think a lot of us do that. We see patients who don't want to develop any problems, they want a checkup. Or others who want an MOT because they have that in the background, maybe, lower back pain or neck pain or whatever. And they just want to make sure that it's not going to get worse and they're not going to have another episode. Yeah. So they come for these MOT sessions. But also if you look at the policies from the government, the NHS, there's a big move towards prevention because of course, with these lifestyle related disorders like, type 2 diabetes, high blood pressure, cholesterol, which are having, very large negative effect on individuals, but also on the society. There's a big push towards there. And we went in the literature and there's not much at all for the three professions together. So I was surprised.
I am surprised, and I thought that physiotherapy at least would have an awful lot of evidence behind it. And there is a tendency, I feel, for us to see our professions, if not all three in competition with each other, chiropractic and osteopathy in competition with physiotherapy, because they are the big profession in the country.
Yeah, so we found 21 papers on the topic. I mean, that's ridiculous.
Yeah.
That's really small. I think we should really place ourselves as key professionals who can really, take part in this movement around prevention. Wherever you stand, if you want to look on a sort of philosophical point of view, it makes sense for our professions. I'm thinking about chiro and osteo here. If you think about patients, patient care, the sort of principles with which we want to, do some form of treatment, prevention is really core to our principles. But nevertheless, and I suspect it's probably a lot of what we do in practice and some of the PROMS data and all the surveys we've done over that, it seems to suggest it's the case.
The PROM data, the patient-reported outcome measures.
That's
data.
right,
Yeah.
That's right. And we can see that a lot of our patients who come to us, they've had persistent pain and they might be coming for a new episode or because they don't want another new episode. So I think that probably is a good, it is what happens in practice, but we don't have any evidence of that. And therefore, if you have the government and they want to fund whatever sort of project or anything, we can't really say we're here, we're very good at what we do because we don't have that evidence. And so I think it is important for our professions to really move towards prevention, to demonstrate that we are safe, we are effective, we can mobilize that knowledge into preventing MSK problems or any other sort of issues.
But how do we do that? I mean, that sounds to me like it's a massive prospective study of some sort, where you've got a huge database of patients who don't have any problems and you're just trying to show that they don't get any problems in the future.
Yeah, so you can do that. So we mentioned PROMS, the patient-reported outcome measures. That probably wouldn't capture that very well, to be fair, but we have the infrastructure to start capturing some of that data. And as you mentioned earlier, Dan Bailey came in December or January here to discuss the practice-based research network. And so we have now 570 osteopaths in the UK, which I don't know, it's probably 500 clinics who have agreed to being members and to start, supporting and collecting data. So we are building that sort of infrastructure to be able to do these sort of, quite large longitudinal studies to start capturing some of these elements.